Welcome to a fourth and final discussion where our expert panellists will consider implementation enablers and other supports available to GPs, general practices and residential aged care homes to support the implementation of the General Practice in Aged Care incentive. Introducing new incentives into busy service settings like general practices and residential aged care homes can be complex. In this discussion, I asked panellists about key implementation considerations for the General Practice in Aged Care incentive and activities, many of which are already typical practice in primary care, that can facilitate smooth adoption. Each of our panel members represent a different perspective of the team involved in implementing this initiative. Panellists, let's go around the room. Please highlight one or two system enablers that can be leveraged to support successful implementation of the incentive.
I think there are some real opportunities here in relation to the incentive to really look at our processes and our practices within the general practice setting. And that starts, right from the beginning of how you actually register new patients to the practice or new residents to the aged care facilities that you're visiting. So it's really about ensuring, as I said, that you have some practices in place so you don't miss people. And that, speaks to how you might code new patients as being residents of an aged care facility. The other aspect to that is also making sure that you put in place some fairly stringent processes for ensuring that you're recording how you're meeting the various requirements of that incentive. Now, that might look very different from one practice to the next because you might only have a handful of people in residential aged care, which would make that quite an easy process, or you might have a few hundred, in which case you're needing a much more robust process. But you do need to make sure that you put something in place for that. And that speaks to what we have spoken about before, which is consistency and timeliness of the care that you're providing people. I see a real opportunity here, and it speaks to something that was mentioned before about how you might engage new general practitioners into this space. And that's the involvement of registrars. Certainly in the practice where I work, general practice registrars are always given the opportunity to engage in the services we provide to aged care facilities. For some of them, it's not their thing and they decide not to go on with it, but the very vast majority of them absolutely love it. They engage very, very positively with it. They are often our backup person when the regular they will visit in tandem with the general practitioner, and if the general practitioner is on leave, they are then our go-to person. And it also means that when they fellow, they have some experience in that space. So I think that's a real opportunity for general practices who take on registrars and are also working in the aged care space to look at how they might involve those registrars in that space.
Enthusing the emerging general practice workforce around this. It's going to be such an important area of future care, but it gives the incentive a longevity as well with the workforce coming on stream.
I think there are a few challenges that are certainly being experienced by primary healthcare practitioners, and one of those is access to medical records when they are working within an aged care home. There's a range of different products, and each of those products have different functionality, and that also makes it very challenging to be able to interface with general practice software. Many don't at all. and also for GPs to have access to that. So what that requires then is for the GP and the residential aged care home to have an agreement as to how the GP will be able to access those medical records. And also then, how do those medical records that are recorded in the aged care home, how does that then come back to their general practice, and what does that look like? Making sure that that's a secure method to be able to do that. So it is very much about setting that communication base and understanding those challenges, and then looking at ways that that can actually be adapted, and for there to be reasonable workarounds, because that can be quite time consuming. And My Health Record plays a critical role in being able to support the system as an enabler for general practice and the team, but also for residential aged care. I think one of the other key components is having GPs understand the home and understanding components of that home. And that's really important because that enables access, and being able to be clear about where they can find different things within the home, but also who do they contact when they need support. Because we often hear from GPs that I will enter a home and there won't be a nurse around. I can't find anyone on the floor. And that's because they're busy and they're doing the work. But it's really important for a GP to know how to actually contact those people if they need them when they're entering that home, and looking at the scheduled visits, making sure there's agreement around those. And when they happen, if they are a scheduled visit and a planned visit, is really important between both parties as well.
Layla, your thoughts on implementation considerations where we can learn and rapidly, continuously improve, and your top 2 or 3 facilitator or enabler thoughts?
One of the biggest areas from an implementation perspective, or the biggest change, is really going to be a bit of cultural change about the way we interact. And I think it's really easy for us to say that now that we have these incentives in place, that we will just automatically do it and do it well. I think that's not necessarily just on the general practice side, but I think it's on the patient side as well. I think, learning how to interact in a team-based, when a patient is only used to dealing maybe with one person, I think we'll start to sort of see, not all patients will necessarily want to do that or be able to do that. And I think that there is a bit of cultural change that needs to go, and maybe adapting. So there's a bit of gentleness that's going to go into molding this relationship and extending it out beyond necessarily the way that we've done it before. And that, of course, is also about it's back to relational management, isn't it? It's back to going back. And if I was to think about from an enabler perspective, I think about something as basic as scheduling. So when we do start to work these things out, making sure that, the patients and their families have plenty of time to get themselves involved, particularly the families who often miss out on the visits when they come in. And if we're going to be more regular about it, then it's even more important that they're part of the rhythm of how these interactions actually go through. And that might include things like My Health Record and their access to the information. But I think there's a lot of enablers, but I think there are things that we just need to, we can't assume that things are just going to slot in because we say so. So I think there's a bit of work to do on both sides to sort of get it to sing.
And that's proactive implementation, isn't it, around multidisciplinary team ethos and practice and consumer and carer participation? Yeah. Anthony, your thoughts on implementation considerations, the key ones, and for facilitators and enablers of those?
So I think one of the really positive things that's coming out of this incentive is it's actually compelling the care teams or the medical care teams to really engage with aged care facilities and aged care providers. I think one of the issues has been in the past in aged care is, given the complexity of care, there's a lot of different stakeholders and they're perhaps not talking to each other. But I think now as I said, we're being compelled to start talking with each other to actually, for want of a better word, enable this system to start working smoothly. I know myself anecdotally with my own personal practice and my team that works with me, we have been actively engaged with our aged care facilities to see where their challenges are, to see how we can help each other. So I think for me, the big enabler here has been communication and open lines of communication. External to that, engaging other people, not just clinical in my practice, the administrative staff, to have a role in delivery of care. I think it's also been a very powerful thing from a practice point of view. They've really engaged in that. So I think, again, another positive thing that's coming out of this incentive is enabling not just the clinical staff, but the non-clinical staff. And we think we've heard before from Sophie about how, from a practice point of view, it's important to ensure that these patients feel like they are part of the practice and not just an external afterthought. So they would be my sort of primary thoughts on enablers, and I think it's actually a very, very powerful variable that's happened with this.
There's an opportunity here for streamline processes. I think what this gives us an opportunity to do is look at user-friendly registration. I think a massive enabler in all of this is the PHN. With the you already mentioned before, Kate, around the IT connectivity, digital literacy, and I think there's a position here where we need to upskill the sector, and that is to really enable the residents to understand how My Medicare can enhance their care ability as well. So, and I think that comes through supportive guidance, comprehensive resources, and visibility of resources. There are a number of resources available on the websites, as we know, and it's just ensuring that the visibility of those resources are understood and known. I think that digital integration is really important, linking the patient the residents and providers registration systems and existing health records, which would then enhance the efficiency and accuracy of medical records and care consultation. In terms of enablers, I think the increased collaboration with the providers, so the aged care providers, is always a positive. I think coordination between the facilities and the GPs will ensure that person-centered, driven care, and also timely resident registration and care provision. Flexibility, I think there's some flexibility in this incentive, but it's also having the understanding of how the flexibility can support the care provision. And again, that comes back to visibility of the resources and understanding of the incentive itself. And that comes back to incentive awareness, so clear communication about the benefits and the incentive motive, like how it motivates participation from both the patient and the provider's perspective. And as I've said before, communication, relationship, and all those other things that are really beneficial and crucial to the incentive being positively implemented. I think Layla mentioned cultural and social impacts as well. I think it's really important that we build a culture of respect, and that person-centered or person-driven care is actually enhanced through the reputation of the aged care providers and aged care services.
I think that orientation at the residential aged care facility that they will be visiting, and the option of working alongside aged care staff for a short period of time just to see how the facility operates. Each aged care facility is different, and they need to be involved in a shared trust and understanding required to build the necessary confidence as a team.
One of the things I think we do need to work on will be how we get the patient and the family on board. So we have had quite a bit of education for the general practice team, but I think looking at how we bring in the aged care team, both the patient and the family, what's the benefits to them? And we know from lots of activities in the past with things like health assessments, if patients want them, they'll drive that activity. And so making sure they know so that they will drive that activity, and they'll be asking us to sign up, not just us chasing them to sign up.
It's a really well-intentioned incentive trying to nudge us that work in the system towards a more proactive, planned approach to comprehensive general practice. It's different to what we've been used to in the past. So really understanding the why and its intent is important. And within the resources, there are, patient stories that kind of point to the why. The second thing I think then is, we've heard about the importance of people being aware as to the why, the consenting process, the registration with My Medicare. There's a whole bunch of tools already out there, resources available. And so to look at that, I very much urge people to take a continuous quality improvement approach to this. So don't try and get everyone registered straight up. Start with a few, use the tools, look at what's working for you, learn the process, and design the process using that continuous quality improvement approach. I think once we get comfortable with the registration process, the conversations to have around consent, then it's about delivering the requirements of the incentive. The delivery of the requirements of the incentive really does require a little bit of planning, monitoring, tracking, and again, there are tools available to do that. It's about looking at the tools that are available and adapting them to individual circumstances, in individual practices, and actually starting to use those tools. Again, using that continuous quality improvement approach, learn from them and adapt them. And, eventually in the fullness of time, maybe, it will become an automated process around the tracking and monitoring. But what really, really excites me about this incentive is the potential for team-based care. So part of the enabler, I think, is to have conversations in your practice. How can the practice nurse help? If you have a practice pharmacist, how can that person help? Can you work with nurse practitioners around this? How will communication look like? How will you decide who does what and when? I think those conversations are really important. They're really exciting. Putting together a pathway of how you deliver care to this population of people residing in residential aged care homes, it's a wonderful way to sort of start thinking about the implementation of this. And like I say, it won't happen overnight. Using that mindset of continuous quality improvement is the way to do this. And, if you're a clinician, if you're a GP, you can also document this and put it towards your continuous professional development, which is a sort of added bonus. So, that's what I'd like to encourage people to do, is focus on tools that are there, use the supports that have been talked about, but using an incremental continuous quality improvement approach.
To conclude this session, as we've spoken about before, primary health networks have an important role in providing system-level support to primary care, including the implementation of this incentive. Can you please remind us of the broader PHN support opportunities that can be tapped into by all stakeholders?
I think there's certainly a number of facilitators and enablers that PHNs support at a system level, because PHNs provide that system level support. And that's, as I've talked about before, that connection of the system and across the system to support that patient journey and the resident's journey in this case. Definitely education is a role of PHNs. PHNs have three distinct roles, one being capacity building, and that certainly is working with residential aged care teams in building capacity in those teams to be able to support primary healthcare access. And that includes, as I said earlier, around supporting digital health and telehealth. But the other part of it is also educating and supporting general practice teams and supporting them to work differently and considering how they do need to work differently in order to manage the change that this particular incentive is bringing as well. And that's really important. Supporting and facilitating the development of those relationships, as I've talked about earlier, and helping the two parties to agree upon what those working relationships will be and how a GP or their team will be supported when they are on site at a residential aged care home and what that actually looks like, and also opportunities for the GP and the team to be involved in the residential aged care home as well. Some residential aged care homes have medication management committees and they have GPs represented on those committees, and that provides a great opportunity for GPs to be able to understand how the home works, but also to understand and to contribute to some of those decisions that need to be made at a clinical governance level and support the role of the GP in that home as well, and most importantly, the safety of that resident. And there's ways that PHNs can support that because they have an understanding of the general practices. They have also got an understanding of the residential aged care homes. Another enabler of PHNs is being able to support residential aged care homes who cannot find a GP and are really struggling to be able to access a GP. And we know that that's very variable across Australia. And certainly that is a key role of PHNs in this. So one of the key things that PHNs can do is work with the residential aged care manager to support them to be able to access GPs who provide care in their local area to residential aged care homes and to support that connection. They don't do it at the individual patient level, but they do it at the residential aged care home level, and they will support that care manager to support that connection as well. And if there isn't a GP that's available, then they will look at what other options are available, and they might be able to actually fund a particular model that will work in that area to support that.
This brings us to the end of our discussions with expert consumers and health leaders on the implementation of the General Practice in Aged Care incentive. In this fourth and final conversation, our panellists have stressed the benefit of planning, change management, and a continuous improvement mindset around the incentive's implementation. And they've offered practical actions such as making good use of My Health Record and other digital tools, embracing My Medicare voluntary patient registration as a mechanism to ensure GPs and practices understand they have an accountability for their registered population of people living in aged care. Ensuring personalised cycles of care that are proactively managed with a sense of common goal and a clarity of roles across the integrated practice and aged care team, including the future workforce such as registrars. And finally, tapping into the local assistance and support available through primary health networks. We hope during the General Practice in Aged Care Incentive series, our panellists have provided some useful insights into why it's important and what the incentive aims to achieve. We recognise that there is no standard one-size-fits-all approach to the adoption of the incentive. Ideas offered on how it can be implemented in general practice are reflective of our panellists' views. Clearly, every participating GP and practice working with local aged care home partners will need to establish their own implementation pathways. Our word of advice is to reach out to your local primary health network for guidance or support if needed. Finally, I'd like to close by reiterating that the incentive aims to promote access to high quality, proactive, planned and continuous care for all people living in residential aged care homes. If you would like more information to support implementation of the General Practice in Aged Care Incentive, there are several resources available from the Department of Health and Aged Care's website. They include fact sheets, program guidelines, patient journeys and information kits for GPs and practices, aged care residents, their families and carers, residential aged care providers and peak bodies. Services Australia, My Medicare and individual PHN websites are also sources of further information.